Sjogren syndrome is an autoimmune disorder characterized by dry eyes and dry mouth, resulting from the immune system attacking the glands that produce tears and saliva. Management of Sjogren's syndrome typically involves symptom relief and addressing underlying immune system activity. Here are the key aspects of managing this condition. 1. Symptomatic treatment. Dry eyes. Artificial tears. Over-the-counter lubricating eye drops can help maintain eye moisture. Prescription eye drops. Medications like cyclosporin restasis or lifitegrast can reduce inflammation and increase tear production. Punctal plugs, small devices inserted into tear ducts to block drainage and retain tears on the eye surface. Dry mouth, saliva substitutes, over-the-counter saliva substitutes or mouth gels. Chewing gum, sugar-free gum can stimulate saliva production. Pilocarpine or civimeline, prescription medications that stimulate saliva production. Good oral hygiene, regular dental checkups, fluoride treatments, and maintaining oral hygiene to prevent cavities and oral infections. 2. Systemic treatment. Anti-inflammatory medications, non-steroidal anti-inflammatory drugs for joint and muscle pain. Hydroxychloroquine, an anti-malarial drug often used for its immunomodulatory effects. Immunosuppressive medications, methotrexate, azathioprine, or mycophenolate mofetil. These drugs can be used to control severe systemic manifestations. 3. Lifestyle and home remedies. Hydration. Drink plenty of fluids throughout the day. Humidifiers, use in living areas to maintain moisture. Avoid irritants. Reduce exposure to cigarette smoke and alcohol, which can exacerbate dryness. Dietary adjustments, avoid spicy or acidic foods that can irritate dry tissues. For monitoring and managing complications, regular eye and dental checkups to prevent and manage complications. Screening for associated conditions, regular monitoring for associated conditions like lymphoma, thyroid disorders, and other autoimmune diseases. 5. Patient education and support. Education, informing patients about the nature of the disease, potential complications, and the importance of adherence to treatment. Support groups. Participation in support groups can provide emotional support and practical advice from others living with the condition. 6. Advanced and experimental treatments. Biologic agents, rituximab and other biologics targeting B cells or specific cytokines are being investigated for their effectiveness in more severe cases. Clinical trials. Participation in clinical trials exploring new treatments can be an option for patients with refractory symptoms. HER 7. Management of systemic involvement. For extraglandular manifestations, e.g., vasculitis, neuropathy, tailored treatment involving systemic immunosuppressants or biologic agents. Overall, management of Sjogren's syndrome is highly individualized, focusing on relieving symptoms, preventing complications, and improving quality of life through a combination of medications, lifestyle modifications, and supportive therapies. Regular follow-up with healthcare providers is essential to monitor disease progression and adjust treatment as necessary.